Hello, welcome to Appalachian Wellness. For a new tomorrow and a new you. My name is Dr. Owen Brink, and I'm here to go over a quick review of tick-borne illnesses common in western North Carolina. There are some common local ticks. The black-legged tick, Ixodes scapularis. It's widely distributed across the eastern United States. This is what it looks like. There's also the Lone Star tick, Ablyoma americanum, especially common in the southern eastern United States, and the American dog tick, Dermacentor variabilis, east of the Rocky Mountains, also along the Pacific coast. This is what the black-legged tick looks like. You'll notice the prominent black legs. The adult female is larger than the adult male. The nymph is even smaller, and the larva is the smallest of all. This is shown next to a dime to give you an idea of the scale. The same scale will be used to look at the next two ticks. The Lone Star tick, very similar in size, slightly different shape, does not have the prominent black legs, has the white dot on the top of the thorax dorsum. And then there's the dog tick. Anaplasmosis is one of the tick-borne illnesses. It's not quite as prominent in the Asheville area. You see it more along Greensboro, Winston-Salem, up into Virginia. Babesiosis, again, not too common in North Carolina. Ehrlichiosis, now we're getting a little bit more common. And of course, the big bugaboo, Lyme disease, which is something that all of us should be very much aware of and afraid of. This one is a real monster. It's an incredible organism. It really does some damage. And Rocky Mountain spotted fever. You'll notice it's not so prevalent in the Rockies, but sure is prevalent east of there, and certainly in the North Carolina range as well. And finally, tularemia. There's just one case in Tennessee, as I can see, another one in Kentucky, some in Virginia and West Virginia. Cat scratch fever is a similar disease. This is from Bartonella hensei. It's got a worldwide distribution, more common in children under 15 years of age. It usually comes from fleas that are on cats, usually strays. This is what it looks like. Trench fever is another Bartonella. This one is Bartonella quintana. Transmission by the human body louse, common with homeless or areas of high population density with poor sanitation. And that's what this little critter looks like. Anaplasmosis, incubation period of 1 to 2 weeks. Signs and symptoms: fever, chills, rigors, severe headache, malaise, body aches, muscle aches, nausea, vomiting, diarrhea, loss of appetite. Rash is not real prevalent, and remember, not everybody develops all of these. Lab findings common to this illness: a mild anemia, low white blood cell count and platelet count, respectively. There may be some mild to moderate elevation of the liver enzymes. Detection is by DNA polymerase chain reaction. You can also look for a fourfold rise in the IgG antibody titer via immune fluorescent antibodies in paired serum samples, often drawn within the first week and 2 to 4 weeks later. Immunohistochemical staining is another way to look at these. Basically, what happens here is antibodies are formed against the organism. They are labeled with fluorescent dyes, and staining involves placing the antibody on the slide so that the fluorescent stained antibodies will then attach to the antigens on the surface of the organism. When you look under it, the right light in the microscope, these areas will light right up, showing you where the organism is hiding. This is a polymorphonuclear site, a type of a white blood cell surrounded by some red blood cells. And you can notice on this cell, there's a little inclusion body to the right of the nucleus, and that would be an anaplasmosis inclusion body. Therapy was with doxycycline. Adults, 100 milligrams twice daily for 14 days. Children, 2.2 mg per kg twice daily for about 14 days as well, maximum dose of 100 milligrams. One of the big concerns we have with using tetracyclines, such as doxycycline in children, is staining of the teeth, especially when given at an age less than 8 years of age. We don't see too much of that with this, however, especially not with the doxycycline. You may see it more prominently with tetracyclines of the other type. You must always consider Lyme disease concurrently and other microbes going on. These tick-borne illnesses, just because the patient has one illness transmitted from the tick bite, does not mean that there's no possibility of other illnesses also being transmitted. They all have fairly similar incubation periods. They're all pretty much cause the same symptoms, flu-like symptoms, incubation period of 2 to 3 weeks typically. They may or may not produce a rash. A lot of them do produce rashes, but the rash is not necessary for the diagnosis to be made. The best way to make the diagnosis, unfortunately, is with the paired acute and convalescent serum, which means you can look back a few weeks later and say, oh, gee, here's what you had. It's not so much a big help at the time of diagnosis. Babesiosis is caused by a group of organisms that become intracellular parasites within the red blood cell, transmitted by the black-legged tick, Ixodes scapularis. Can be transmitted by transfusion and also mother to child congenitally, picked up in utero. Risk factors for severe infection: absence of the spleen, a condition known as asplenia, advanced age, generally older than 70, impaired immunity of any kind. Complications from babesiosis include low platelet counts. Disseminated intravascular coagulation is a bleeding disorder in which the blood clots, using up all the clotting factors, then the clot dissolves, and it keeps going through this cycle until there are no clotting factors left, and the patient basically bleeds out. Babesiosis can cause shock. It can also cause impairment and full failure of the lung, needing respiratory support on a ventilator, kidney requiring dialysis, liver, brain failure, and death. And if you look, you can see all these little inclusion bodies within the red blood cells, which are significant for babesiosis. Incubation period on this one is a bit longer, 1 to 9 weeks. Signs and symptoms, again, flu-like symptoms: fever, chills, sweats, malaise, fatigue. Chronic fatigue syndrome could be missed as this: nausea, vomiting, diarrhea, abdominal pain, dark urine, an enlarged spleen, enlarged liver, and jaundice. Laboratories, you'll see hemolytic anemia. The organism gets inside the red blood cells and causes the cells to burst. Low platelet counts, marrow failure. Elevated BUN and creatinine is significant for kidney failure. Transaminitis, elevations of the SGOT, also known as the ALT, and SGPT, ALP, signifying liver failure and problems. Identification of the intracellular parasites is the best way to make this diagnosis. It can also be done with polymerase chain reaction, a form of serology. Treatment is similar to malaria. Similar drugs are used, such as atovaquone or Mepron, a very expensive medication, 750 milligrams twice a day. Azithromycin, 1,000 milligrams a day for 10 days. That's a very high dose of azithromycin, by the way. Also, quinine can be used, or with clindamycin at 600 milligrams every 6 hours. Again, that's a pretty high dose. More information on Bartonella species, cat scratch disease, and trench fever. It's a gram-negative organism, most commonly causing cat scratch fever and trench fever. Clinically, you'll start with a papule, or small bump, or a pustule, or fluid-filled bump at the site of the initial injury or bite, with enlarged, sometimes tender lymph nodes proximal to the site that appear 1 to 3 weeks after exposure. Healthy folks don't have too much of a trouble with this. We'll see people come in that have a swollen lymph node that may or may not be tender. And if you ask, you might find out that they've been playing with a cat or have a cat or whatever. The presumptive infection then would be called cat scratch fever. Usually these folks are not clinically ill. They'll just come in because they have a lump under their skin and they're worried about it. Cat scratch fever, prolonged fever, follicular conjunctivitis, neuroretinitis affecting the brain and the film on the back of the eyeball, the retina, encephalitis, inflammation of the brain itself, Infection with trench fever, causing fever, headache, rash, and bone pain, especially the shins, neck, back, etc. Diagnosis, is by serology, blood testing. False negatives and positives can occur not only with this, but pretty much with all of the tick-borne illnesses. Treatment: azithromycin, doxycycline, tetracycline, fluoroquinolones, trimethoprim sulfa, rifampin aminoglycosides, and actually stevia, the natural sweetener, has been found to have an anti-Bartonella effect. It helps to kill these bugs, which is a pretty sweet deal if you ask me. Ehrlichiosis. Ehrlichia chafensis is the most dangerous one of these critters. There's also Ehrlichia ewingi and Murus euclarensis. Chafensis, as I mentioned before, can be fatal, especially in young children and older adults. The other ones are not as serious. The incubation period is a week or two. Signs or symptoms pretty much like all the other ones, with altered mental status being a little bit more prominent and rash being a little bit more common with children. And this is a lymphocyte, and you can see right here we have an inclusion body. This is the nucleus of the lymphocyte, and these are red blood cells surrounding the lymphocyte. Lab findings: low white blood cell counts across all lines of the white blood cells, the polymorphonucleocytes, including neutrophils, basophils, eosinophils, and the lymphocytes, including T and B lymphocytes. Low platelet counts, anemia, mild elevation of liver enzymes, detection of the DNA by polymerase chain reaction in blood, fourfold or more rise in acute and convalescent antibody titers, and IHC staining of skin, marrow, and other tissues. Treatment: doxycycline, just like before with so many of the others. And you continue the treatment until at least 3 days. And here is the monster. Incubation period anywhere from 3 to 30 days. Signs and symptoms pretty much like the others. You start possibly with a rash. It may not always be present. You end up with flu-like symptoms and swollen lymph nodes. Then you get into the disseminated stage. There may be some multiple secondary annular rashes. Flu-like symptoms and the swollen lymph nodes will occur. Rheumatologic manifestations may happen next. You'll end up with transient migratory arthritis, effusions, which means fluid collection in the joints. It may involve one or more joints. Again, this pain is migratory. It may also hurt over tendons, bursa, which are fluid-filled sacs that overlie bones, where tendons or muscles are overlying the bone as well. It kind of helps to lubricate and shield the muscle and tendon from damage from the bony prominence. Muscles, bones, enthesopathy is basically damage to areas that have poor circulation, such as tendons and ligaments. And Baker cysts are little cysts, or not so much little, they can be a few inches in diameter, that form in the popliteal fossa behind the knee joint. And if you look, you can see a very faint corkscrew appearance. It looks like there's another one right up here, maybe two of them even. There may possibly will be one right along in there as well. The corkscrew appearance is from the order of spirochetes, which is syphilis is probably the most famous of the spirochetes, but Borrelia is another spirochete. And Borrelia, it's really it's an amazing organism. It can live in ticks, it can live in rodents, it can live in people. Not only can it live inside of us, but it can also go intracellularly and hide from our immune system and then reactivate later on. So if you give antibiotics, it can actually burrow into the cells and then poke its head out and reappear later when the antibiotics are not around and continue to do damage. It reminds me of a clip I saw of a movie, War of the Worlds, with Tom Cruise, where aliens invaded the Earth and took over, and they were doing a pretty good job of killing off all of mankind, and then the aliens started getting killed off by the germs that were on this planet. So, you know, monsters can appear, and they may be smaller than the human eye can see. Cardiac manifestations can occur, conduction blocks. You'll see delayed times in different segments of the EKG tracing. Myocarditis means inflammation of the heart muscle. And what you'll see clinically with this is congestive heart failure. The heart is not squeezing as hard as it should. The lungs may fill up with fluid. You may have swelling around the ankles and lower legs. Pericarditis is inflammation of the fluid-filled sac that the heart rests inside. That fluid-filled sac, the fluid provides lubrication, so as the heart is beating, it's not beating itself to death and abrading itself. Typically with pericarditis, you hear some friction run with a stethoscope. You'll also find that the patient very frequently wants to sit up and lean forward, as it does not hurt as much when they're doing that. And sometimes you get a pretty good sized pericardial effusion or fluid filling up that pericardial sac. And that can also aggravate heart failure because the fluid can impair the heart, its ability to fill with blood so it can contract and squirt blood out the way it's supposed to. Neurologic manifestations, Bell's palsy. You'll have paralysis of the muscles on one side of the face. There are also other cranial neuropathies can occur. So there may be visual problems, taste problems, hearing, dizziness, all sorts of different problems can happen. Meningitis is a big concern. The meningi are tissues that surround the brain and spinal cord. You'll get motor and sensory radiculopathies, neuropathies, which are basically means the nerves going out from the spinal column. Mononeuritis, multiplex, different types of single nerves will become involved. You may also see some subtle cognitive difficulties. Neurologic manifestations can go all the way to a full-blown encephalitis. Basically, encephalitis means that the brain is not going to work properly. You'll see everything from coma to delirium. You may see psychoses, anxiety, depression, panic disorder, all sorts of different weird things going on, neuropsychiatric illnesses. Pseudotumor cerebri happens where there is an increase in the cerebrospinal fluid opening pressure when you do a spinal tap. Typically, you'll see a very severe headache with this, and one of the treatments for that is repeated spinal taps to let some of the excess fluid off and relieve the pressure on the brain. Additional manifestation, it can affect the eyes, conjunctiva, line the eyeball, other than the iris and the pupil. That's called where the keratitis is. The keratitis would be inflammation of the pupil and the surface of the cornea. Uveitis involves the anterior chamber of the eye where the iris and the lens are. You'll get a mild hepatitis, liver inflammation, and enlargement of the spleen, splenomegaly, which can also affect the blood count. You'll see some elevation of the SED rate, the erythrocyte sedimentation rate goes up with inflammation. So if the erythrocytes, if this blood is kept in a test tube and not disturbed, they typically settle at a rate of less than 30 millimeters per hour. And if they start settling faster than that, that's an indication that there is generalized inflammation going on in the body. There may be some mild elevation of the liver function test, the transaminases as reviewed earlier, and you might find microscopic amounts of blood and protein in the urine. The cerebrospinal fluid will have abnormally shaped lymphocytes, elevated protein, but normal glucose. Typically with a bacterial meningitis, the glucose will be low because the bacteria are using up that glucose. This does not happen with Borrelia. You may find IgM and IgG antibodies in the serum. IgM can be thought of as the early responder. Think of it as the Marine Corps. They show up fast, they fight hard, and then they go away, leaving the Army, the IgG, to come in and provide long-term immunity. They're more of a policing force. They rise slower, but they last longer, often for a lifetime. There are two major groups, professional groups, that look at tick-borne illnesses such as Lyme disease. There's the International Lyme and Associated Diseases, ILADS, and then there's the Infectious Disease Society of America. They each have different criteria for the diagnosis and treatment of various tick-borne illnesses. ILADS is a lot more prone to recommend aggressive and early treatment and antibiotic therapy, including prolonged antibiotic therapy. The IDSA is a lot more reserved and are much less apt to recommend treatment, and especially long-term antibiotic treatment. As I mentioned earlier, there's a lot of different false negatives that occur with these tests. IGeneX is a company that really does the best job. Their testing is very expensive, though it costs several $1,000s, Insurance does not usually cover it. There are several different bands of antibodies that will show up. These bands are represented by their size in kilodaltons. The kilodalton is basically per thousand as far as the molecular weight for the different antibodies. So there's the 23, 31, 34, 39, 41, and 93 bands. IGeneX, if you have 2 or more of the bands that have the asterisk in front of it, that would count as a positive test. The Center for Disease Control in New York State basically used 2 or more of only the 23, 39, and 43 bands. These are more stringent criteria for making the diagnosis. My personal belief and feeling on this is if somebody's got a considerable risk of having this, I am not opposed to giving them what we would call a therapeutic trial or probe of an antibiotic such as doxycycline for a week, for a month, and wait and see how they respond. These folks will often find that if they're taking antibiotics for any other reason, they just feel better. And when the antibiotic is over, they start to feel worse again. So if they have a respiratory infection, urinary infection, whatever, and they're put on antibiotics, they feel better. When the antibiotic course is over, they feel worse. So there are also some good questionnaires that we can use. I've got one on our website developed by Richard Horowitz that has actually been validated in the peer-reviewed medical journal. And anybody that wishes is welcome to take that test. It's free, and I'll be happy to score it and get back to you. Treatment of Lyme disease, first-line treatment, doxycycline, again, 100 milligrams twice daily, but this time for 3 weeks. Ceftin, cefuroxime, Axetil is another antibiotic. It's a cephalosporin, and amoxil, which is a derivative of the cephalosporins. Again, all these treatments are for 3 weeks. Children, basically the same type of therapy would be given, dose adjusted for size. And again, stevia has actually been shown to have activity against Lyme as well as Bartonella, which I think is pretty sweet. Lyme treatment considerations, there's a lot of things to keep in mind. Borrelia burgdorferi has been found in numerous forms and has different stages in its life cycle. As I mentioned earlier, it can affect ticks, rodents, people. There's also very strong evidence that it's been weaponized. There is a book by the title Bitten, written by Chris Newby, that goes into a lot of detail, makes a very convincing argument that this may have been biologically engineered, genetically engineered to make it more toxic. Reading that book will certainly give you some more information. Part of the reason this disease is so hard to diagnose and hard to treat is the various false negatives that come up, and the lab testing. Also, it forms what's called an L form. This is a form of the organism that can actually migrate inside the cells of the host, where they're hidden from the immune system, so the immune system can't fight what it cannot find. And then after the threat of antibiotics or what have you has gone by, these things can pop out again and cause further problems. The immune system, again, can't fight what it cannot find. And when you've got antibody tests that have false negatives, that means the germ is there. Testing says it's not there. Boy, it's a real difficult situation. We need to find antibiotics that will not harm the host while it still gets into the host cell and is able to harm the pathogen. It's not an easy. I'd like to talk also about the Jarisch-Herxheimer reaction, otherwise known as the Herx. With some of these organisms, especially the spirochetes, when antibiotics are given and the organism is being killed off, it releases toxins, and these toxins released by the dying microbes cause a worsening of symptoms and appearance of new symptoms, and they can really be quite severe. You can reduce the Herx reactions with adequate sleep and antioxidants, including glutathione, alpha-lipoic acid, N-acetylcysteine, vitamin C, quercetin, curcumin, and Eclonia cava, which is a brown seaweed extract. There are numerous other medications that can be added to the typical antibiotics, and again, seeing the Herx can be a sign that you're having effective killing of the organism. This can be a good thing when you have a Herx. As I mentioned earlier, there's the therapeutic probe, and the fact that patients also feeling better when on antibiotics for other reasons. One of the things that can be very helpful is put somebody on an antibiotic for a month, and after the patient's been on it and they've stabilized for a week or two, Give them a medication that is known to provoke Herx reactions. If they don't get a Herx, that means they probably do not have the organism inside of them. However, if you give a Herx provoking medicine and it does produce a Herx, that's a pretty good indication that the lab is a false negative. The patient truly is infected. Now, the fact of the matter here, too, is some of the medications used to produce a Herx can make the patient a lot worse clinically, and they can be dangerous. So this is the sort of thing, you don't want to do this on somebody who's really, really critically ill, or you might kill them with it. But if you use it right and if you use it conservatively, it can be very helpful. Some of the Herx medications, tinidazole is one. Also disulfiram, which is also known under the trade name of Antabuse. This was a medicine that was used to treat alcoholism because it causes such severe hangovers. And as luck would have it, it can also has inherent anti-Lyme properties to it. The bad news is, although it can cause a Herx reaction, it can also precipitate an acute psychosis and really severe reactions. So you have to be careful of this. Other Lyme treatment considerations, as mentioned earlier, these diseases can be polymicrobial. There might be more than one organism going on from one tick bite. Keep an eye out for things like Babesia, Bartonella, Anaplasma, Rocky Mountain spotted fever, Ehrlichiosis, tularensis, all the other critters as well. Borrelia can also change its protein composition and shape when exposed to antibiotics. So that's another trigger that can make these things, as I mentioned earlier, become dormant and go intracellular. When antibiotics stop, they can kind of go in and hide and pop out again later. There are antibiotics that are active against the Borrelia. Physical barriers such as biofilms are another issue that can keep the organism away from the antibiotic, and some of these things do produce a biofilm that they hide within. Some antibiotics can eliminate both the growing and the dormant forms, such as daptomycin, cefuroxime, and doxycycline given together. Daptomycin, mitomycin, and ceftriaxone given together. Vancomycin is more powerful than doxycycline, but it does have a more serious side effect profile. Mitomycin C can kill persisters, disulfiram, and hygromycin A, which is an antibiotic that's not used very often, is derived from soil bacteria, can also be helpful. And again, as I mentioned earlier, augmenting therapy to provoke a Herx reaction with drugs such as tinidazole and disulfiram can be helpful in helping to clarify whether or not there is an active infection going on. And again, as mentioned earlier, stevia, a couple weeks worth of that can be a good thing. Essential oils are also more potent against these critters than non-volatile oils, and unsaturated fatty acids work better than fatty acids that are saturated. Some good examples would be bay leaf oil, cassia oil, eugenol, and cinnamaldehyde are the active ingredients of some of these oils. Dapsone is an anti-leprosy drug that has anti-Borrelia activity. There are also certain botanical and herbal preparations, proprietary in nature. I like one that's known as biocidin, and we can hook. These should best be considered as complex chronic illnesses. There are many factors that go on, including co-infections, other infections, immune system dysfunction, autoimmunity, food sensitivities, allergies, leaky gut syndrome, mineral and nutrient deficiencies, often due to the leaky gut syndrome, environmental toxins, detoxification issues can play a role here. Sleep disorders are another big part of it, with disruption of the lymphatic system, which is a lymphatic system within the brain that cleans out nicely during sleep, and that's why sleep is so essential in healing. Rocky Mountain spotted fever, incubation period of 3 to 12 days. Signs and symptoms appear usually after 1 to 4 days: a high fever, headache, body aches, fatigue, malaise, GI symptoms, nausea, vomiting, diarrhea, loss of appetite, rash, which may or may not be purulent. Usually it shows up 2 to 5 days after the onset of symptoms. It's a small, pink, flat, non-itchy spots, macules. It spreads proximally, starts off in the distal areas, the wrists, forearms, ankles, spreads proximally to the trunk, sometimes even involves the soles and the palms. In the later stages, it turns red to purple as petechiae, which can be found by pressing on them, and if they do not blanch, that's what a petechiae looks like. Petechiae can be a sign of much more serious things as well, such as Neisseria meningitis and sepsis. The petechiae usually appear about 6 days after symptom onset. This is a slower progressing illness than you would get with overwhelming sepsis from Neisseria. The rash again could be absent. Signs and symptoms of late Rocky Mountain spotted fever can include multiple organ system damage and organ failure. Brain altered mentation, coma, respiratory failure may require a ventilator, renal failure may require dialysis. You may actually get necrosis to the point of requiring amputation of digits usually, but it can be whole extremities. Lab findings: low platelets, low sodium. That doesn't happen with everything. Liver enzyme elevations, the serology fourfold rise in acute versus convalescent serum. There's immunohistochemical staining if you've got this in your list of suspicious organisms, and also isolation of DNA. Treatment: again, doxycycline for at least 3 days after the fever breaks. Tularemia has an incubation period of 1 to 21 days, usually 3 to 5 days. This often happens from flea bites and also from skinning animals. Signs and symptoms include fever, chills, fatigue, headache, malaise, myalgias, body aches, anorexia, loss of appetite, nausea, vomiting, diarrhea, abdominal pain, chest discomfort, and cough. Presentations: it can show up as an ulceroglandular with localized lymphadenopathy around a skin ulcer. It can be oculoglandular around the eye with photophobia, the light hurts your eyes, increased tear formation, inflammation of the lining of the eye, the conjunctiva. There may be some lymph nodes in front of the ear. Oropharyngeal looks like a really severe sore throat. Typhoidal, any combination of the above generalized symptoms. Pneumonic, non-productive cough, chest pain, hilar nose, effusions. Lab findings with this: normal to elevated white blood cell count, creatinine phosphokinase, which is an indicator of muscle damage, transaminases, the liver enzymes, low sodium, low platelets, fourfold change in acute and convalescent sera, IgG titers, and direct immunofluorescence, polymerase chain reaction, or isolation. Treatment options: streptomycin is really the primary course. 1 gram intramuscularly daily for twice daily, for 10 days. Gentamicin, ciprofloxacin, or doxycycline for 3 weeks. Similar doses are given to children as I'd like to speak briefly now about chronic inflammatory response syndrome, CIRS. This was first described by Richie Shoemaker, a family doctor out of Pocomoke, Maryland. He's just a small town country doctor. The guy is just an amazing genius, very, very smart individual. He coined the term that genes load the gun, exposure pulls the trigger. About 25% of the general population is genetically susceptible to this illness. Folks who should have picked better parents. The human leukocyte antigen, the HLA on chromosome number 6, there are several different haplotypes. A haplotype is just a form of genetic expression. When I was younger, I had red hair. My wife has blonde hair. Those are different haplotypes. Basically, what's going on with this is there's faulty antigen presentation by the macrophage, which essentially engulfs and eats germs, to the T lymphocytes. You can think of it as a faulty off switch within the immune system. The immune system turns on, okay. If it didn't, we wouldn't be here. You would have died a long time ago, or your ancestors would have, but it does not turn off properly, leading to chronic inflammation and autoimmunity. Exposure can be from anything that causes cytokine storm. Cytokines, you've heard of hormones. A cytokine is like a hormone, but it works within a microscopic neighborhood, typically eliciting inflammation in that neighborhood. So if you get a splinter in your skin, you'll have cytokines that are being formed in the area of the entry, bringing white blood cells into that area to get rid of the infection. So these cytokines are very tied in with the immune system and are used to fight and cause inflammation, to fight infection. In the Asheville area, mold is probably the most common cause of this cytokine storm. Other things, of course, would be tick-borne illnesses such as Lyme, uh, Listeria, Cyanophyta, blue-green algae, shellfish harvesting beds, dinoflagellates such as red tide, sigmatoxin, which is a dinoflagellate that can affect tropical marine predator fish. Trigger this. The Sears pyramid really gives us a good idea of how to treat this. The very first step is removal from ongoing exposure. Typically in this area that's going to be mold, but whatever the exposure may be. Cholestyramine is a medicine that was originally released to lower cholesterol. It doesn't work very well at doing that, but the three-dimensional structure of this molecule is such that it tends to bind biotoxins very effectively. Welchol doesn't work quite as well. It's another cholesterol-lowering medicine that works through the bile. The liver is arguably the largest organ in the immune system. It filters the blood. When it filters toxins out of the blood, it secretes them into the bile. The bile then goes to the gallbladder, which concentrates by removing water. Bile is essentially thought of as a detergent. If you don't have a gallbladder, maybe you've had it surgically removed, the bile is constantly being dripped from the liver into the intestine. If you do have a gallbladder, when you eat a fatty meal, the gallbladder contracts, squirting the detergent into the gut to help break down the fats so that the fatty nutrients, essential fatty acids and whatnot, can be absorbed. So basically what cholestyramine does is it binds to the bile acids and to the toxins so that at the last part of the small intestine, the ileum, normally what would happen is that the bile is reabsorbed and shuttled back to the liver and recycled. With cholestyramine, it passes out through the stool with the toxins. Multi-drug resistant coagulase negative staph, MARCoNS, is a type of germ that can grow within biofilms in the nasosinus. If that organism is present, you have to eliminate it as well because it can lower the melanocyte stimulating hormone, which we'll get to in a minute. A lot of times these folks will have an acquired gluten sensitivity, similar to celiac sprue, but as opposed to be a congenital that they were born with, this is actually an acquired form of it. Normalizing the androgen and sex steroids in general. Androgens typically are lower in this illness. Correcting antidiuretic hormone and osmolality is important. This disease frequently will cause a lower amount of antidiuretic hormone, which is normally produced by the posterior pituitary, and it helps the kidneys to concentrate urine. When you don't have enough ADH, you're frequently putting out very dilute urine, which means you're constantly wasting water, you're fluid deprived and dehydrated. So these are the folks that have to frequently get up and go pee, and they're also thirsty all the time. Correction of matrix metalloproteinase 9, vascular endothelial growth factor, and C4A, which is a complement enzyme. C3A is another one that are involved in the immune response. And then some folks don't get better until you correct their elevated transforming growth factor beta 1. And in some people, we actually have to go all the way to the top of the pyramid and use something called vasoactive intestinal peptide, which is a cytokine that is used to therapeutically correct a lot of the problems that occur with SIRS, including pulmonary hypertension, which is high blood pressure within the pulmonary arteries, and also it corrects brain problems. So from the toxic encephalopathy, it can restore normal brain volumes to the different subparts within the brain. So whereas a tick-borne illness can make you sick, if you're one of that 25% of the population who should have picked better parents, after the Lyme disease is cured, this condition can just kind of smolder on for years and decades. It will shorten lifespan and it causes a great deal of suffering. Anybody who's been diagnosed with fibromyalgia probably has this. Chronic fatigue syndrome is another very common misdiagnosis of SIRS. This is the SIRS biotoxin pathway. The key point to looking at the SIRS biotoxin pathway is over here in the upper left-hand corner, the toxin comes into the body. The upper part of the pathway will tell you more about what's going on immunologically, but what I'd like you to pay attention to is this reduced melanocyte stimulating hormone, MSH. MSH is actually a link between the neurologic system, the brain, and the endocrine system, the hormones. Basically, when you have a low MSH, you will have sleep disturbances, you'll have severe pain, just really kind of turns the volume up on pain. GI problems, irritable bowel syndrome type complaints, prolonged illnesses, you don't heal well, changes in cortisol and ACTH, adrenal fatigue is this term that people may have heard, reduced androgens, the sex steroids, reduced ADH, the diabetes insipidus we talked about earlier, persistent coagulase negative staph, and problems with just persistent ongoing inflammation. All these things are due to the reduced MSH. The reduced MSH can also be caused by MARCons and helps to generate more MARCons. It's a feed-forward amplification loop that goes on with this. So it's a real problem. The only way you can really elevate the MSH, there are no medications that can do it. You need to be on a low amylose diet. Amylose is a sugar found in bananas, root vegetables, and seeds, including grains such as wheat. And I went right past something that was important, unfortunately, the biotoxin pathway. Let's see. We've already talked about the difficulties with the ILADS and the Infectious Disease Society of America. Joseph Jemsek actually had his license removed. He was an infectious disease specialist. He now practices in Washington, D.C. He was following the ILADS protocols, and Blue Cross Blue Shield didn't like paying for the antibiotics that he was using and got a hold of the medical board. There was some collusion with the medical board. They actually drove him out of the state. That's why, again, I like people to use the free SIRS screening test that I put, and also the multiple systemic infection disease syndrome screening test that are both on our website at apwell.net prior to going with any long-term antibiotic treatment. And I'm doing this as much as anything for my own protection from the medical board. Anyway, we are Appalachian Wellness, and thank you very much for taking the time to review this presentation.